like most of the newcomers, I had a dream of having a better life here in Canada. But it was really hard at the beginning to look for the job of what I want to do at the beginning, and because of the culture, language barrier, and back then I didn't have any family members and friends at all. And but soon I realized no matter what kind of job I have to do, I got to survive. And then I saw the one nail salon was hiring, and then they asked me to pay for the $300 for training fee. And since then, I have been working in the nail salon for until right now, until now. And I tried a few times to change my job, but nothing happened. In 2014, supervised the Health Community Center create a nail salon worker project. I got a chance to join this program. And I really learned a lot from this program. And also this project making me more understand what kind of work environment we are facing, and what kind of risk we have, and how the nail technicians educate their ability to protect themselves. And in these 4 years, we have been outreached for over 100 nail salons, and thousands of flyers has been delivered. And we also did 4 topics of the workshops in the nail salon. And about 80 nail technicians attended the 4 topics this workshop. With more nail salons we have been outreached, and more nail technicians we connect and talked, we realized that's not enough. Because most nail technicians, they are working long hours, like 9 o'clock in the morning to the 8 o'clock at night. And they normally pay for by commission. They don't have a basic employment protection, like vacation pay, holiday pays, and this is like a norm in the nail salon. It's normal, you don't have this many. They are also facing the bad working environment, like the bad air quality. And I have been working almost 10 nail salons until now, and none of them have a proper ventilation system, and fighting the nail dust and artificial nail dust, and the chemicals are whimpering in the nail salon, and like acetone, alcohol, nail polish, and all kinds of things. Also, you can smell the food smell from the waxing room, because they don't have the space for the technician to eat. So they just hide in the waxing room or the basement. They don't even have the proper gloves to work, and so it's easy to have a skin problem. No matter how bad your skin, itchy, flushed, you have to work because you can't afford to stay at home. You can think about it. The nail technicians working like this working environment, how bad for their health. Now I'm also working as an outreach worker at a nail salon nail technician network. We aim to bring more nail technicians getting together, provide the supporting service, basics on what they need, like English class, improve their language, and deliver the health information, and also the workers' right, let them know. And I'm very excited I have this opportunity, because I will be able to improve my own understanding and empower the people like me by providing them all the knowledge. Through sharing my experience, I'm hoping more the people can join us to build a new technician network. And as you can see, we are stronger when we support each other. Thank you.
I'm going to shimmy down so that I can change my slides. All right. Hi, I'm Kate Ahrens. I work at the Parkdale Queen West Community Health Center. I'm a health promoter there, and I'm one of the lucky folks that gets to work with Jackie and a number of other folks on the Healthy Nail Salon Network for this work to improve working conditions in nail salons. So this is just basically everything I'm going to talk about, and I'll elaborate on everything, but this will kind of keep me in order. Just really briefly, Leslie did a nice intro of what the network is. We work for better working conditions and healthier salons for primarily nail salon workers or technicians, but thereby for visitors to salons as well. We're made up of nail salon technicians, community health centers, and other healthcare providers, community agencies, legal clinics, public health staff, labor groups, academics, and health and labor advocates. So we're a robust group. As Leslie mentioned, we started in 2014. The very brief history from the community health center perspective, because that's where I insert, is that in 2014 we got a women's college hospital grant, the Women's Exchange grant that helped start the project within the health center. There was outreach into nail salons, getting in touch with nail technicians to find out what are the challenges and health concerns that you face in your work, and what are the barriers to improving those conditions. And that through that work we ran into other people and agencies that were also working on this issue, and the project culminated in a round table in the fall of 2014 where a number of us have met and sort of made a plan and identified a need for starting a network. So off we went. Our priorities are outreach, so maintaining relationships and outreach with nail salon technicians and owners in salons. One of our goals is to start outreaching to the public, and how do we start making public messaging that can build the group of allies. We know that consumers will have a powerful voice in this case, but that's hard work, both in terms of capacity and knowing exactly what that messaging is, that we don't alienate people from going to salons. How do we really get people to support technicians, support the changes that owners want without sort of demonizing owners and separating those two groups. Research is another big piece of the network's work, and Victoria is going to speak to that. Advocacy, so as I mentioned, it's about the physical conditions within the salon, but also employment conditions. And we kind of operate at 3 levels. So the municipal level is mostly through the new licensing that salons are supposed to have. We know many don't, and the standards around that licensing is still really limited in terms of what it offers workers and owners for protection. And then the Body Safe program that monitors personal service settings, which really is geared towards the consumer and making sure that infection prevention and control is the focus, and it's really about stopping that spread of communicable diseases for the customer, and little to no protection for workers through that program. So our advocacy is looking at things like that and the licensing, and sort of trying to wiggle our way in to how can we improve those standards and conditions within that existing framework. Provincial, there's the occupational health and safety, so labor standards and enforcement, what protections exist, who's getting missed through those protections, What are other ways of educating and training, because we know that it's not happening in salons. We just finished 4 case studies in salons that we've had an ongoing relationship with, and Jackie, one of the salons that Jackie and her peer partner Lee have been working with, the woman has owned the salon for 20 years and is so grateful to have the information and training, and she said, you know, nothing like this have ever been offered to me before. I didn't know where to find it. So that, you know, and that's a story we hear again and again. So what are better ways that we can connect with these small businesses when there are thousands of them, and provide that level of training that people are saying that they want. And then at the federal level, chemical regulation and management, that's where we overlap with the federal jurisdiction, and concerned about the number of toxics in the nail salon products. So a couple of people on the network are involved in the chemical management plan review, and I'm not too clear on the details about that. It's not my area of expertise, but you can imagine that banned substances are still appearing in nail salon products, and then we know that the banned products that are still allowed to exist, we really don't know much about what levels people are being exposed to, and at what levels are they dangerous to people's health, especially in combination with those other toxics that are there. So the role of the community health center, where I work, we're fortunate because we operate from a social determinants of health framework, so we get to sort of tackle the whole range of issues facing these workplaces. And I don't need to list them here, we've heard them. But yeah, income, job precarity, education, gender, race and culture, really great from a community health center lens that it's sort of all within our purview. And we get to respond in a variety of ways. So based on the needs of the community, we can support research that's happening, advocacy, education and training, connecting with services or looking at the barriers to care. So it works well from within that model. Our ongoing work from the CHC, kind of the umbrella of the Nail Salon Workers Project, is certainly ongoing work with the Healthy Nail Salon Network and supporting the projects that network is taking on, connecting with nail technicians, going after funding to continue the work. Our work so far has been founded on peer outreach workers and educators, so always finding ways to continue to fund those positions is really essential to the work. And reaching out to other cities, that's another piece, sorry I missed about the network. Another one of the pillars that we've been operating on is finding out who else is doing this work in other cities in Ontario, across Canada. We've made connections with projects in the United States who are years ahead of where we are in terms of regulation and legislation to protect workers in nail salons. So learning what path did they follow. California, very similar, started from a health lens, worked to push for legislation for better protections. And then there's another example where New York, there's a New York Times piece in 2015, I believe, exposing the labor and health violations happening in salons, and that just catapulted them forward years of work. So regulation came down really hard, and then nail salons and owners had to run to catch up, and agencies were kind of, what do we do? How can we help all these people? So very different ways that a number of different places have entered this work, and we're trying to learn from all of them. So sorry, back to the specific work that the CHC is taking on now. When I say CHC, it's Community Health Center. We're leading the Delivering Workplace Health and Safety Education to Nail Salons project, which is the Ministry of Labor funded 2-year project where we've continued the peer-led model of outreach, going to salons, offering education and training on 3 different topics, as Jackie mentioned. I can't remember if you listed them, so I'll list them again. Respiratory health, reproductive health, and ergonomic health. So all salons started with the reproductive health model. 21 salons in total got that training, and that was really just limited by our funding. The nice thing is that rather than having to convince people. I mean, in some cases, you've had to work really hard to convince people to let you in the door, but as soon as they're in the door, oh, I have a friend who has a salon who will want this training, and we've had more demand for the workshops than we can actually meet, which is encouraging and also very sad on another level, because we just can't. We're a team of 5 people. Reproductive health was first, then we moved into ergonomic health, and now we were just wrapping up with respiratory health. And so with each topic, salons got a workshop, and then we build a training module where ideally we could share it with another city to say, if you had peer educators, you could use this sort of training template for content and facilitation training, and then go out into salons and do a very similar thing. And then we follow up with a resource that we're translating into Vietnamese and Mandarin or Chinese to share with those same salons. And for every workshop topic, we do pre and post surveys, and then, as I mentioned, we've done this in-depth sort of case study model to just find out in a little bit more detail how have these workshops impacted and what are some of the most significant outcomes for some of those salons. We're really just ending that. I wish I had some more outcome numbers for you, but what I can say sort of anecdotally from the surveys that I've seen coming in and the case studies is that main messages are, yes, wow, I've wanted this kind of education. Do you have more workshops that you can deliver? In some cases, people saying, I've known a lot of this stuff, but I haven't been able to convince my employees to do it, or which I thought was sort of interesting, because I think the assumption in many cases is that it's the other way around, which we've also heard. But ultimately, a lot of the structural things like toxic chemicals in the products and ventilation systems are really big and insurmountable changes for these small businesses, often renting a space so they don't even have control over what kind of ventilation is in the facility. So that awareness piece, but feeling a bit, what else can I do, or a bit stuck about some of those bigger structural changes. Yeah, we continue to learn from questions and concerns that come from those workshops, and the peer educators have done an amazing job of tracking forms after every workshop, questions that were asked, other concerns. We really want to know how to continue and give feedback on this project about where else could we go with this information. And what we're finding is that after a project before this, we did skin protection, and now we've done these 3, that we're kind of getting to the point where they're saying, I don't know, you tell us what else we need to know. Like, so it's an interesting point to, like, we sort of have to come up with the issues at this point, but that it's a very captive audience at this point. And then another big outcome from my perspective is the leadership development of the peer educators, seeing roles that someone like Jackie is taking on, and how important and essential that is to our project, and how can we sort of build continuity into, if any of you work on these funded models, then it's like the peer workers are often the ones we're like creating these precarious work environments where we're funded project to funded project, and really our relationships with the salons and with this work is absolutely tied to people from within that community. So that's one of the challenges. And maybe I'll just leave it there, and then if there's more questions about successes and challenges, and then I just put contact info, that's for the Healthy Nail Salon Network generally. And then we don't actually have our own website, so soon there will be the Parkdale Queen West website will have access and entry to the network's work. But that link is not yet active, so stay tuned. Stay tuned.
You can bookmark.
Yeah. Thank you.
So good afternoon, everyone. So my name is Yan. I'm from Chinese and Southeast Asian legal clinics. It's a community-based legal clinic where we're funded by the Legal Aid Ontario, providing free legal services to low-income, non-English-speaking community members from Chinese, Vietnamese, Cambodians, and Laotian communities across Ontario. So I think I'm going to talk about how myself got involved in the organizing of nail traditions and where we are right now. I'd like to also acknowledge my colleague who's also here, Min, also a community legal worker from the same legal clinics, and Min has been primarily doing outreach in the Vietnamese community, right? I guess before we got involved in the, so later we're going to talk about Nail Technicians Network, which is a network that we hope to provide space for nail technicians to come together, to communicate, to share issues, and then take action to address those issues collectively. So I'm going to have some foundations about foundations and then like principles that Nail Technicians Network is built from. It's understanding all these issues, understanding people's immigrant women's vulnerabilities. So based on that principle, we initiate the Nail Technicians Network. So before we got involved, my connection is also by participating at the Healthy Nail Salon Network that Kate was mentioning. So I got involved in the end of 2016. So when we got involved at the clinics level, at the community clinics level, on the kind of daily work that we do encounter issues from nail technicians, and then we often provide legal advice to nail technicians as well as provide legal representation for them for when they file the Employment Standards Act claims and Ministry of Labor. So from early on, we have kind of identified those issues that we think nail technicians who work at discount nail salons. So when we often say discount nail salons are those kind of provide $30 to $40 manicure and pedicure, the full set. So there is increasing number of nail salons in the downtown core, in the city, in the suburbs. You see nail salons just popping up in almost every plaza that you go to in the suburbs. So first things, and it's like Jackie has also mentioned some of the issues that she has heard other nail technician experience. First thing is really pay fees to get training when they're actually working. So I think I guess we have to begin with, a lot of women who work in discount nail salons are immigrant women from China, Vietnam, or South Korea, or other parts of the world. So it's kind of easy kind of entry job. People, which understandably people think perceive it as better than working in manufacturing. So, but of course they have to pay fees to get training, and then they've been often called as intern in this salon. But what they are actually doing is they are also working. They're working with the cleaning, they're working as receptionists, they're working as assistants. But at the same time, they have to pay fees to get experience, to get exposed to their skills. So training fees range from $300, $500, sometimes $800. We heard about a training period is usually determined by employer when they say you're good. So we heard from clients like training periods be 2 months. Another big issue which has trickling effects about other entitlements and benefits that nail technicians have is really misclassification. They are employees, but they often be called or misclassified as self-employee. employer will often tell them to get a business number yourself. We are not, they never get pay stub for the numbers of hours of work. So often, as a result, they're not getting the Employment Standards Act protections like minimum wage, vacation pay, public holiday pay, overtime, or termination pay. Another is because they're often being paid cash, they don't get check, of course they don't get statutory deductions. So which affects their employment insurance benefits. We've seen women, when we do outreach, which I will talk about later, activities that Nail Condition Network has been doing, which is visiting nail salons, and then we see women, pregnant women, we can see they're kind of approaching the due dates, but they're still working because knowing that they won't get maternity leave benefits, they won't get parental leave benefits. They have to work really hard to save up their cash, which kind of sustain them for a year when they're taking care of the baby. Even if, third point, even if they're considered as an employee, they often receive sub-minimum working conditions in terms of sub-minimum wage, no vacation pay, no public holiday pay, no overtime. Another issue that we have identified by talking to Nail Technician is a lack of pay transparency. Employer often determine your pay. There's also varying pay structures within one salons. I think that's all determined by employer. They ask you how many years you've worked in the salon and what can you do. So we have, so Jackie also mentioned this, people are being paid by commission. Flat rate is usually for nail technicians who are just entering. So perhaps after training period, when you're able to do kind of basic manicure, pedicure, you get flat rate like $7 per day or $100 per day. Again, Jackie was mentioning they have to work from perhaps 9 a.m. to 8 p.m. So commissions also, people are being paid by commission. Wages, I guess like could be split half, 50-50 between employees and employer, or 60-40 employer-employee. So it's really negotiating with the employer. And sometimes people kind of experience nail technician, they'll get commission plus base salary. Again, base salary would not be minimum wage. So that commission will kind of bump up to the minimum wage, which is legal, but sometimes they use tips to bump up the minimum wage, which is illegal. So I think what we would like to highlight is really the prevalence and systemic employment violation that have been really normalized. Recently, we have heard a few nail technicians from one nail salon talking about, so employer, there's change of ownership in the salon. Employer have changed, and they were paid hourly rate, minimum wage, which is kind of rare in the nail salon sector that we have come across. And with the change of owner, she said, I'm gonna pay you commission exclusively, which of course will lower their pay. And there, of course, the employees will say, no, this is not fair. The employer's response was that, see all these nail salons owners out there, they're doing this, why can't I do this? So I think what should really make worker feel hopeless and helpless is that, like people kind of like it's normalized. It's normalized that nail technicians, some nail technicians getting sub-minimum working wage and salary. So I think it's not necessarily about this nail salon owner. It's just about the perceptions among all the owners out there that they can treat employees like that. So I think I'm going to talk about why there are several reasons that our clinic got involved in organizing the nail technicians, primarily for two reasons. One is again, we're serving, providing legal services to the Chinese and Vietnamese communities. And then again, the immigrant women working in those salons are immigrant women from China and Vietnam. So it's kind of fitting with our mandate. Another reason is we provide legal services to low-wage immigrant workers, like the restaurant workers, like the ethnic grocery store workers. And we do see those groups of workers not necessarily coming forward, knowing the change kind of employment relations out there, but they're not necessarily coming forward. We understand, like, definitely all these vulnerable factors make us kind of understand why they're not coming forward. There's so much at stake that they don't want to come forward. If it's coming forward just for the money, they don't bother. If coming forward, I think often we see low-wage immigrant workers coming forward because there has been kind of injury to their dignity, their self-esteem, their respect, not being harassed by employer. So there's like extra level kind of injury that makes them coming forward, not necessarily the money. So we have really identified nail technicians, all these vulnerable factors, gender, race, as a newcomer, having language barrier, as a newcomer not being able to get a professional job, economic constraints and discrimination, as well as immigration status. And also not aware of social services available. So also unique relationship with the employer. I think people found a job not necessarily through employment center. They found a job perhaps through family members. So having relying on the employer not just for this job, potentially future employment opportunity, potentially information on navigating the society system. So having that unique relationship really make people become even more exploited. So that's why we think it's really important to create a network, a space for nail technicians. So this network that we're currently part of, it's initiated by nail technicians themselves, as well as nonprofit organizations like the Park Health and West Community Health Center. Actually, when it was created, the Nail Salon Workers Project in 2014, there's association, Nail Technicians Association, and then we actually, it's continuing to work, and we change it to network because association sounds a bit more authoritative. Like we know everything, we don't know everything. So we change it to network. So we provide a variety of skills, development training, and social events for nail technicians. Our goal is to provide space for them to share, to collectively take action to address their concerns. I think we really want to have encompassing framework. We do not make assumptions about what issues that we think you have. We want to create a safe space for nail technicians to come together, identify the issues, and then building capacity. There are, as discussed also in Victoria's presentation, there are several issues that nail technicians are experiencing, like are we going to get nail technicians licensing? Right now, only nail salons need a licensing. Are we gonna? There is nail technician like nail technicians classes at community colleges, but those are probably only available for people who have higher language skills and then have the time, have the money to go through the college and get licensing, which is not often available for immigrant women just came to this country. So there are also issues of ventilation that mentioned. Workers' rights violation, workplace harassment, and also discrimination. So all these issues, so I think we want this space to be sustained by nail technicians in the long run, whatever issue that they would like to identify and address. So finally, so what we've been doing, so we try to increase the awareness of nail technician network in the community. So we've been doing outreach. That's the photos of us doing outreach in North York at the nail salon. And the picture below is last year we did a trendy nail designs workshop. So we're not, so we don't want to like go out in the community. There's workers' rights events because it really scared of the workers as well as the employers. We don't want to have a neutral presence in the community. When their space is ready to talk about issues, we will kind of have it organically formed. So, and then we'll also try to, so outreach, we've been doing outreach to across GTA, Brampton, Markham, Northport. Then we're gonna kind of do more outreach in the summer. Social media, of course, we'll have different social media strategies catering to different communities. So Vietnamese has been most popular. It's on Facebook, where it's Chinese communities. It's WeChat, which is equivalent to WhatsApp. So we do skills development workshop that we've been doing is nail designs and then also English conversation circle. We're able to do that in salons. So it's a big issue, the language barrier that nail technicians experience, and not having the opportunity to practice, not having the time to go to classes, and then that really put constraints on their work. We've talked to nail technicians who has really limited language abilities, and her vision has come down a lot after working in a nail salon. And then she was saying because she can really communicate with the customer to kind of smooth over their encounters. So she has to concentrate so hard on cutting the nails because she tried to avoid bleeding on customers' fingers. So she concentrates so hard because she doesn't have that language ability to compensate, like her ability to really communicate with clients. But as if you have better communication, customer understand you, but she's relying on herself to try to do the best work as possible. So as a result of like using so much of their just seeing things, her vision has gone down a lot over the years. So we also do logo design contests and then also picnics. We also have newsletters, so things that we try to distribute when we go out to make people know about us. Yeah, so if people are interested, thank you so much, Victoria. So we have Vietnamese, Chinese, and people if you are interested in reading the English version. So just useful information to nail technicians. Yes. So last point I'd like to make is really how we work with service providers, the frontline workers, settlement agencies. I'm not sure whether settlement is familiar. You guys are familiar with settlements. It's been mentioned in other sections throughout the day today. So they receive funding from IRCC to provide services to newcomers. So they are often their first point of contact with immigrant workers, including nail technicians. So they're not necessarily coming to settlement worker with nail technician related issues. They usually come, for example, for interpretation services, with help with forms filling. And then through this encounter, settlement workers became aware that they are nail technicians. And I guess even settlement workers are not necessarily aware of all these issues that nail technicians experience. I hope that by working with settlement workers, they can be support, they can be allies, and they can be source empowerment for nail technicians to speak about the issues. Here's our contact information. I can take more questions after Victoria's presentation. Thank you.
I'm going to do a little bit of a rundown on the research that's happening that's, pardon me, very much embedded in the nail salon network. So not the nail technicians network, but the nail salon network itself. And I thought I'd just show you, we're talking about there being a lot of salons. Toronto Public Health estimates, I think the number they gave us is about 3,400 salons in the city. And this map shows salons that had been inspected by the Toronto Body Safe program as of last summer. and it's not 3,500, but it's still about 1,500 at that point, I believe. And you can see that it's really all over Toronto. There aren't really any gaps in where the salons exist. And this program is limited to Toronto, which is why the pegs stop when you get to the city limits. The salons don't, but the scope of this program does. So way back when the network first started and Kate's predecessor was at the CHC, Lynn Holness, who's a clinician at St. Mike's and affiliated with the university as well, was contacted because she has a strong interest in occupational disease, and then she reached out to me. We have a long-standing relationship. She was my PhD supervisor. But I have a strong interest in occupational exposures and measuring workplace exposures. And I'm based at the Occupational Cancer Research Center, but also appointed here in the Dalla Lana. And so we got involved as researchers, and we've taken on several projects, some small, some bigger, over the last few years. And one of the first things we did was some qualitative interviews with the peer educators who were involved at the time around barriers and facilitators to occupational health and safety in nail salons. And one of the things that came out quite strongly there was what was mentioned earlier, the personal connection that the nail salon technicians often have to the owners in terms of being given their first job upon coming to Canada and feeling like they didn't want to jeopardize that. And this was done by a medical student who's now actually working in primary care and still very active in terms of wanting to promote health and safety among nail technicians and other beauty workers, actually. We've done several surveys, so paper-based surveys of nail salon workers, both connected to the workshops that Kate mentioned, so the skin workshop in particular. But we also have a student out now extending this survey work and asking workers about symptoms they're experiencing, what their tasks that they're actually doing in the salon, and the health and safety practices that they use. So questions around their use of respiratory protection or glove use. And this has been interesting because from the research perspective, we know that there are chemicals in the workplace, and Jackie talked about a lot of them. So acetone, there's acrylates in the polishes, which are highly sensitizing chemicals. There's also the toxic trio that people talk about, which is formaldehyde, toluene, and dibutyl phthalate. So toluene is a solvent, formaldehyde is a preservative, and dibutyl phthalate is a plasticizer, so it keeps things flexible. But those are all very scary and quite toxic chemicals. But we don't really know a lot about what's happening in the workplace in terms of exposure levels or the symptoms at a population level in terms of how prevalent problems are. And so that's what we're hoping to identify with the surveys. And one of the things that did come out, which links to what Jan just said nicely, is we were expecting workers to have skin rashes and to have breathing problems, but eye strain was actually the most common symptom that the workers reported on the most recent survey that was completed. So it has identified problems that I think we hadn't thought about or we hadn't prioritized. And I think that's an important thing that's come out of some of this work where we've been talking to the workers in their workplace largely. We have, from a policy perspective, done an analysis of the Toronto Public Health's Body Safe Program inspection data, and we've sort of touched on it, but it is part of the personal service licensing requirement that they are inspected annually, and as Kate said, its focus is on infection control, it's not on exposures, and it's not on occupational health and safety. But some of the infection control practices, like wearing gloves or changing or using single-use items only once, can reduce exposure of workers to particularly biological exposures, but also chemical exposures to some extent. So we thought it would be interesting to look at this data, and we're just wrapping this up, but that's the project that the map comes from in terms of looking at where the inspections have happened. I can tell you about a third of the inspections resulted in a conditional pass. So quite a lot of salons were not fully meeting the requirements for infection prevention and control, but over the years of data that we've looked at, which is now about 3 years of data, only 2 salons were ever shut. So those critical infractions that would be of high concern to the public health inspector were quite rare. The conditional passes were more common relatively. Dr. Holness has taken a leadership role in the clinic at St. Michael's Hospital, and they've published a few really nice articles to raise awareness among the clinician population about acrylates specifically. They've had several workers but also clients come through with hand dermatitis in response to acrylates, and they're pushing this to family physicians but also to clinicians more generally through the peer-reviewed publications. They got a publication in the Canadian Medical Association Journal, which has very wide audience of physicians across the country, so they're quite excited about that and hope that that raises awareness broadly. The largest study that we are doing is an exposure study in nail salons here in Toronto, and this is currently ongoing. We got money also from the Ministry of Labour through a slightly different arm than the nail salon project, their nail salon workers project. But we followed the lead of the CHC in a peer outreach style of work, and we hired folks on to the OCRC where I am, and last summer and fall they spent a lot of time walking the streets in Toronto, talking to salons and encouraging them to participate. So they went into over 175 salons, and the 26 salons agreed. We've now done the sampling in 12 salons, and we're doing quite a broad survey of exposures in these workplaces, looking at some of the chemicals I mentioned, formaldehyde, toluene, and phthalates and acrylates, but also we're doing a bit of a screen on ergonomics to see about how much repetitive motion there is, the angles of their neck when they're working and things like that. And we've also asked them a bit about job strain, which is one tiny aspect of psychosocial stress that they could be experiencing in their work. So this is ongoing, and we're very excited about this. I showed you that. But what I wanted to move into is just maybe saying a few words about how the network really has supported and focused the research that we've been able to undertake. I think initially a lot of our conversations identified the gap. So there was a lot of concern about chemicals, but we didn't have good data. And the data that we did have came from other places. And as Kate alluded to, there's a federal level of regulation that controls what should be in products. And that may differ by country. And so there was a sense that we didn't know what was happening here, and we needed to know what was happening here. And that was really good support for us as researchers to take forth this idea to funders and demonstrate that there was a need for this, and the community agreed with us that there was a need for this. And I think there's been a lot of shared learning about those gaps and what we can fill and what we can't fill, and I think it's been positive for us. It's really a community-driven process, which for me as a researcher is new. Often we have ideas about what we think research questions should be or need to be, and then we go out and try and drum up support from community groups to try and get money or make it feasible. And this has been very much the opposite, and we've come up with questions and ideas and taken them forward, and I think it's been perhaps slower in some ways, but it's been more effective in the long run. I think we've had a lot of funding success both at the CHC and from the research side. That has been better than I've experienced in the past, so I think that's positive. In terms of the challenges for the research process, I think it's, I mentioned that Lynn Holness and I are at the table, but our expertise is quite narrow, and the questions are very broad. We've talked about this, employment standards, immigration and settlement, and we're really one tiny slice in terms of occupational exposures and occupational disease, and we haven't yet really tried to get other people at the table, but we've talked about it, and I think that's something we will do as we evolve. I think a concern from my perspective, or something I think is, we can do research, it doesn't always have the result that we want, and then what do we do? And that having that discussion up front and making sure we're aware of what the impact might be or the implications might be of the results that we get. And so that's something we haven't had to deal with yet, but I think we're getting closer and closer to having results where we're going to have to jump the shark, so to speak, on that one. And I think that also comes to the differences in interpretation or risk tolerance and how precautionary people want to be about making decisions or recommending changes. And so I think that's something that we've also worked through in a lot of the communications materials in terms of what we want to communicate to workers and on what evidence base we're going to make those recommendations. And I'll just wrap up with a couple of reflections. Because it's so unique as a researcher to have such an active and engaged stakeholder group, I think I've been really pleased and really excited to see how engaged the workers and the employers are. And they have a shared interest because often the employer in the nail salon is also a worker and they're doing the manicures and the pedicures. And we haven't really gotten the owners and employers engaged. We've talked about it a lot. I think that's something we'll continue to revisit and see if we can do it in a way that is constructive for everyone. I think as a researcher, doing research in small and even medium-sized enterprises is actually a big challenge unto itself. A lot of the work I've done before has been in large unionized industries like mining, where there's established labor organizations and employer organizations, and you just need to talk to one person to make big headroads. And in an industry like this, there isn't a single stakeholder. You really have to get out there. You need many, many businesses to participate to make the research representative and generalizable. And in terms of communicating those results back, you then have to go back to all of the people and make sure that folks know what came out of the work that you did. And so this is challenging, but like I said, it has been more successful, I think, than I anticipated. And I reflect a lot on this in terms of occupational health and what's coming down the pipe, and I think I see the Uber Eats people and the all the the individual people in the gig economy, and how are we going to deal with that problem? I mean, this is one problem, and that's sort of a step farther. So I see this in a way as a bit of a learning experience for all of us, but particularly for us as researchers. And my role and Lynn's role, I think, really in terms of the network and addressing these concerns of the nail salon technicians is to keep exploring and building up the evidence base, because I think we're still lacking in this area. We have a good idea what some of the employment standards are. We have data and evidence for that, but we don't in terms of the exposures and the health effects. And it's a particularly challenging group because, like Jan said, they're not licensed, so doing large epidemiologic studies is actually really not feasible currently. We cannot enumerate the population, and in order to study health effects at the population level, we need to be able to do that. So we need to keep building the evidence and amplifying. I think I'm looking at that. We need to keep raising these issues at the policy table, because I think as researchers, that is something we have. We often have a connection to those bodies, and I think that I continue to take it forward, and we'll do a better job. But yeah, so I've put my email up there, and then I guess we can just go to questions. So, thank you.
Thank you very much. We have left purposely a lot of time for questions. I'm just wondering if anyone had any comments or questions.
Thanks again for presenting, everyone. Getting to some of the issues of exposure in nail salons, Yan Chen talked about all these kind of intersecting identities that make it difficult to reach some of these workers, and I was struck by how a lot of the chemicals that they're exposed to are chemicals that a lot of the existing health and safety outreach material, both produced by government as well as by other organizations like unions, tends to frame some of those chemicals more in traditional male-dominated, highly unionized industries. So, for example, formaldehyde in manufacturing and the wood products related industry, for example. So I was wondering, I guess, I know you've all done a lot of work on this, but I was wondering if there's been any specific work around improving the materials that exist to target these more female-dominated, racialized industries as opposed to the industries that are already somewhat well-protected based on unionization.
so maybe I'll take it.
Yeah.
Sure.
Chime in.
Yeah. So I think I take it a step back
Yeah.
and being the more cautious, because I am usually more cautious. We know that the chemicals are in some of the products, or we expect that they are. But for formaldehyde as an example, there isn't, to my knowledge, a study that has quantified formaldehyde exposure in salons up until now. So there's a lot of discussion about these chemicals being there, but the knowledge around their presence and at what level they're present is harder. And one of the challenges we have come up against is that the exposure limits, for example, are health-based and based on studies of men, like you acknowledge, and studies in industrial settings where the levels tend to be way higher than we would ever expect to see in a nail salon. And so the question around the materials is whether they're even relevant, because they're going to talk about the things like personal protective equipment, as a last resort, but still personal protective equipment, and it opens up a lot more questions about what these workers can and should do in their workplace. So I think the step is finding out sort of, is it there, and is it there at a level that we should be concerned about? I think that doesn't negate the concern around exposure mixtures that is a persistent question in occupational health, because it's not well addressed. But I haven't looked at the materials and thought about how they would be updated or amended.
Yeah, I mean, I can just say, I'm representing the Ministry of Labor, and I know definitely our internal resources on it are very focused on these more traditional manufacturing. I mean, like the auto parts that are related to formaldehyde, the particle board mills, and I honestly have to say I don't recall, I'm not saying it's not out there, but I don't know if we even have anything looking at exposures like formaldehyde in the nail salon industry or anything outside of kind of wood products and manufacturing. Yeah.
So kind of in the meantime, when we don't have the answers, when we are creating resources, and I brought a couple, I can pull them out, of the issue-specific resources like booklets or a poster in the ergonomics case where we can be handing things out in translated and very specific nail salon industry way. Because we don't know the answers, we often end up having to say things like, we know that effects were like this in a different population or in rats, and so there's a reason that we might need to be concerned. And so a lot of that sort of vague language, and we do list what chemicals other research has said to be present in salons, but yeah, the level, and it's sort of like in that in-between zone a lot of the time of we don't really know, but here's reasons why you might want to be cautious is kind of the language we use.
Okay.
Yeah. Unfortunately, I didn't bring all of them, but these are the English and Vietnamese and Chinese skin booklets, and then this is the English version of the Reducing Risks to Reproductive Health if people are interested.
Hi. Well, no, it's a fascinating project. It's great. Thanks for the presentation. Thanks for submitting it to present here. And it's I'm just curious, I guess, about the engagement with employers, and I guess if any of the skills building, I guess, which is around the IRS and communicating about hazards in general and that kind of thing, just fostering that. Not just empowerment, the workplace dialogue to jointly solve problems in the workplace. I just wonder if you've kind of gone there at all. It's a challenging one, but
I can comment from the community health centers. We're sort of, we knew that getting in the door with health issues was going to be easiest because it affects everyone. There's some simple things that people could feel better about. We're kind of in this moment where a few partners from the network are going to put a funding proposal in to specifically tackle those labor issues and the tougher stuff. And a lot of what I think we're going to need to focus on in that grant is just building the strategy. How do we take the existing relationships when we worked so hard to maintain trust with the owners and the technicians and not villainize anybody, and then move into harder conversations about employment standards, which is just a very different way to engage. I was talking about the network. Events have been held off-site, where a lot of our workshops have been held in salons because, when people are working 10-hour days, Monday to Saturday, how do you ever get people to go somewhere else? And so if the training and engagement is happening in the salons, it just makes it even that much more difficult. We're never really separating the owners and the technicians from each other. And that dynamic within the salon is sort of this, if we start being, we've had to work really hard to be like, we're not going to get anybody in trouble here. We're here just to give information. And so that we're kind of at that point where the difficult conversations we really want to start having, and we don't really know how to yet.
Yeah.
Basic awareness training, I guess, to raise that.
We do not, and I don't think you do, because you were focused on the health.
Yeah, no.
Yeah. So we haven't really at all touched on the requirements, because the thought was that we were obviously going to point out a deficit, and it was going to, that they are not doing something. I think Lynn and I have talked a little, not as a larger group, because we have to report back on this study that we're doing in the salons, and that's actually a very easy way to start saying, well, here's what we found, and so you should be thinking about X, Y, and Z. So I think that in the exposure piece, we will do that with the report back, because we can talk about the exposure limits, because we are measuring some things that have exposure limits, and we are getting levels. We're not getting high levels, but we are getting levels. And so that can open the door to having a conversation about that these things exist and that there's training. And so I think that's our plan in the research realm, is to go back to those folks and to perhaps do it more broadly, even with all of the 175 that we physically visited, because we were allowed to collect that information as part of the study.
I'm curious, Jackie, if you have any, you've worked in 10 salons, if we started talking about know your rights and that sort of internal responsibility, like what the uptake, or have there been any of those conversations in any of the salons?
For example, I just quit my job last week, and I've been working this nail salon for 1.5 years, and half years ago, and my ex-boss sold the business, and the new owner wants to change like commission and lower your no basic salary, and if you wanted only $100 per day, and also she fired the 4 workers that has been working there is 10 years, 9 years, 8 years, 4.5 years. They used to be the very good business, and after her took over this salon, and she want to change the commission, and she doesn't want to pay any benefit for them, and she fired 4 the new 1 reception and 3 new technicians, and she hired all the new technician right now is a better commission on the cash. It's an illegal thing, and when I talked to her and she can't do this, and she said all the nail salons been doing this, why I can't do this? It's normal. It's just sometimes I feel hopeless and frustrated because it's hard to find a nail salon. They pay minimum wage.
Yes.
They doing. We're not asking for the holiday vacation pay, even the minimum wage. So also it's a hard. I also do I'm doing the outreach peer educator, but for us it's really hard to deal with these things, and because most of the technicians, they don't have confidence because of the language barrier, and they don't can speak English frequently, and they're afraid about to lose the job. It's really hard to fight with them because you don't want the new technicians to lose their job, and also the new technician free to report it. And also, if they won't report it, they feel it's, oh my God, there's not a lot of money, they think, and they all the salon is like this, it's okay, it's just, I'm quit, I go. And also, another thing is I just, it's okay, she still pay me, I can stay here, this is not supposed to be my, the long term, the job. I treat this as the job. You know, it's just maybe working there, and then I can change to another place, and as the maybe I'm going to school soon. Yeah, so that's why it's I have been working almost 10 nail salons. You can consider is maybe the 1 year you have to change your job. Also, we can't find the the organization, the governments, the department, which one can help us to solve this problem. Because when we do the new technology network and also doing the new salon work project, we focus on the house. But when you use keeping into new salon, you said your pay is not good. It's still we don't have the power to present we are not that organization to can present, and we don't have power. Yeah, thank you.
I think it's like definitely we're not trying to vilify any employer. Employers are in definitely difficult positions, but we want to kind of building worker solidarity. Like in that situation, what do you do? As immigrant women, sometimes there's no exit. The exit might be working in a factory, which is not preferable. We have experience with people who are able to exit, who are like international students who work part-time as nail technicians in their throughout their schooling, and then once they graduate, they're able to get quote unquote better jobs. But like there are people who get stuck in the limbos, and I think it's really important. Something that we're hoping to do. It's like building worker solidarity that it's happening to all of us, and then how can we all be part of it, addressing the issues, and like Ministry of Labor, perhaps they can do more active inspections, perhaps educating employers about that's misclassification. That's not you cannot call your employee anything, and there are bad things. So employer thinks that if they call employee self-employed, they are self-employed. There are actually legal criteria that determines whether employees are self-employed. So a lot of education, I think, perhaps I'm not sure, like workers' rights and then other immigration status and health. Once we have that space where worker can freely express and then have the wish realized, and then they at the same time realizing their own potential, realizing perhaps organizing will make difference, like realizing their own potential in making a change in their individual situation and also in the systemic situation. Yeah.
It's interesting, the small business initiative is sort of, has chosen as their sort of, not solution, but in short term, to develop the health and safety rep capacity by creating online training for health and safety reps, and then the idea would be to promote the law that says that any workplace with more than 5 workers is entitled to have a worker health and safety rep, and here's some free training. But but how do you ever deliver that and make it in a non-threatening way, I think is an issue. And we found, it's interesting because when I go to farmer conference, so we do similar work with the migrant farm workers, right? So when we go to farming conferences, very much I step out and give them information on their rights and responsibilities, but also from a hazard basis that they are exposed to the same hazard. So we basically try the same vector that you are with respect to health. But we found some traction in the awareness side of things that they, just basic awareness. That's the first thing the Ministry of Labor is going to ask them. If and when they not walk through the door, they're going to ask them whether their employees can show that they have basic awareness. So, and that's a simple thing. It's not solving anything, but it's another vector. It's a different vector, but it's sort of protecting the employer in terms of having delivered it, and then at least it's starting the conversation. But whether it achieves anything, like the IWH research, I guess, has shown that it, as currently implemented, it's not necessarily effective. So it's a challenge. It's to try and make it so it's helpful to everybody, right?
Yeah, and we've talked a little bit about how do you begin to access? So when someone decides that they want to open a salon or they buy a salon, what are the steps that they go through and what are their points of contact where you would have an opportunity to share information with them? And I think that's, aside from being interested in the inspection date, that was one of the reasons that we as a network connected with Toronto Public Health, because they are supposed to be in every salon every year. So that makes them really the only body that is interacting with these salons regularly. And so that's the push, is to try and get some occupational health, at least training, I think, of their inspectors was the first step, but trying to work something into their inspection sheet, because, as people will probably be aware, the public health, even though occupational health is part of public health generally, at the public health unit level it is not. It's a provincial jurisdiction. So there's some issues around cost and responsibility, and there's challenges to doing that. But it is really one of the most logical and easy points to think about how you would flow information.
And just a quick add-on to that, we did have some uptake at the municipal level through the Board of Health, and we met with the chair of the Board of Health, and there was a couple of councillors that were really sort of active and engaged on this issue, and ultimately, so that I think the outcome of some of that buzz was the licensing and a review of what is involved in the body safe inspection. I think I could be getting this a bit gray, but ultimately, when we try to keep pushing it up the chains and work in more, we came up against, this is not seen as a public health issue. This is a worker issue. So go to the ministry, and we're talking about tens of thousands of workers in the GTA. At what point is it a public health issue? So, on our wish list for the network is also what can we do? What avenues can we go down that we can demonstrate that this affects enough people that it is a public health issue? And when people consuming the service are only in there for an hour every 2 weeks at most, maybe, it's a very different, if we're not even sure about exposure levels for workers 10 hours a day. So we're playing a little bit of the labyrinth game, but if anyone has any ideas on the public health thing, I thought I'd throw it out there.
Yeah, we have the same problem on the migrant farm worker, that they inspect the housing there. First of all, that's pre-arrival. Most of the workers, they don't go back and inspect once the workers are there, so it can look completely different, of course, when 8 or 10 people are living in the bunkhouse. And the public health is overtaxed. It's not their space. It's a challenge. So getting everybody stroking in the same direction, I guess. I'm also interested in how New York. The media is very powerful, and how they were able to. It was somewhat inflammatory. I don't know whether there was any actual epi in there. Birth defects and cancer kind of sensationalism.
Like, I think the New York Times, the employment conditions were egregious, and I think that's not to say that we're doing a good job here, but relatively, I think it was a very different situation, or is still likely a bit different. But yeah, it just happens at the right time with a legislator that's willing to make a decision, and things happen.
Just wanted to comment on that. I think I could be wrong, but I thought the New York Times uncovered a human trafficking ring with the situation in New York.
Yeah, and a lot of illegal immigration. I think like it was all of the issues we're talking about, but a bit bigger in some ways.
I have a question just in terms of the chemical exposure. Is it like, do products exist that do not have these harmful chemicals? Is that an option? Or is it just like that is the nature of nail salon products that they all have these chemicals?
I mean, I'm not the expert on that part. Again, anecdotally, when we were going into salons for respiratory health, we thought, let's just see, maybe the alternative polishes don't work. Maybe no one knows where to get them, et cetera, et cetera. So we tried to just do some research, find a company that claimed to be toxic trio free or better than that, and we'll buy some and we'll give them out to salons to test them. And every salon that we've been into since asking, like, have you tried them? It was like, but what polishes? So we still don't actually know. One of the owners said the bottles are too small and it's going to be too expensive, so didn't even try them. And other feedback was, I know that those more natural nail polishes, is what the word was, won't stay on. And ultimately the customer has to recognize the bottle. So I don't know. I think there are water-based ones that actually get rid of a lot of the worst things, but they definitely don't stay on in a way that someone paying for a service, I think, is looking for. Mm-hmm. And that's just as far as polishes. I don't know about the rest.
Well, I think there's, and I'm forgetting who did it, it was one of the regulatory bodies in California, but they did do bulk testing on polishes and associated products, and my recollection is that even in polishes that said they were free of, they were still detecting the chemicals that they claimed to be free of, not across the board, but at least in some cases. And you know, there's a lot of focus on those big three chemicals, but if Lynn were here, the clinical piece, like the sensitizing, the allergen, which is the acrylates, which is what we see lots of in customers and in workers, that is often still in there. That's not one that's easy to get rid of in a lot of the products. So it's tough, I think.
I think working as a work-related asthma coordinator presently with the Lung Association, I'm interested in asking Jackie how many people that you come across with after having worked in all these 10 nail salons that actually had asthma. Have you come across any workers that had asthma after having worked in 10 salons?
I really don't know, but for example, it's like the new technician, you're working over 3 years, and when you do the basic code, and I can feel my throat, I feel is uncomfortable, and I coughing. It's most of the new technicians when we talk is that, oh my God, when I smell this, I feel I'm coughing. And also right now you can see the new technicians, they do like most of them, they don't wear the gloves, but they're using they're touching the acetone, the polish remover. And then they don't have the proper gloves. And when they wear the gloves, they already have the problem. They realize they needed the gloves.
I definitely came across it in the case studies. Anyone that actually, lots of reporting of, I always wear gloves now, but I'm looking around, I'm like, I don't see a single pair of gloves. Like, where are the boxes of gloves? But the few that did were like, I had an allergy, my skin was reacting, so I started wearing gloves. So echoing what you're saying.
Yeah, like you said, if they had asthma, they already quit job. Yeah, because they can't stay the environment like this because they can't breathe.
Right.
That's best practice, actually, to quit if you have a sensitization to asthma.
Thank you. So we only have a few minutes left. Are there any other questions? Hearing none, I would like to thank the panel. Thank you, Jackie, for your personal comments. Thank you very much for bringing this very important topic to the group. I really appreciate the presentations. Thank you.